Welcome to the podcast from Agile Technology. Today we're very fortunate. We're being joined by Dr. DJ Hamblin Brown from Careful Systems Limited. Hello, DJ.
Hello, and thank you so much for having us, Stephen. It's really nice to.
It's a great pleasure. Doctor, I wonder if you wouldn't mind by starting off telling us a bit about your professional and personal background and how you ended up where you are today, sir.
Sure, I'd be delighted. I'll try and keep it brief. Most people describe my career as wiggly, which I think means just basically unplanned. I did computer science as a first degree, and I spent a few years working as a technologist in the City of London. I then went to medical school, having realized that for many years as a child, I'd wanted to be a doctor and I wanted to fulfill my lifetime ambition of becoming a doctor. I did medical school for a few years and then worked as a junior doctor for about 3 years before I realized that being a junior doctor is really quite a difficult job. I mean, not just technically, but it's actually, it's very demotivating and very, it has a degree of personal difficulty about being a doctor, which I think has got something to do with the product that we're going to talk about later, Careful. There's a great deal of repetitive work, and it's the hours are terrible. I mean, I have a lot of sympathy for the junior doctors who are clamoring for more recognition these days. And I left after a few years in order to become a management consultant, and I worked for a couple of small management consultancies who were focused on improving the outcome of the businesses that they were working for, so to reduce waste, improve productivity. And we did lots of interesting projects in unrelated sectors, so oil and gas and various other places, including cement companies and all sorts. Really enjoyed that. But after a few years, I was called back to medicine again, having discovered that there was a thing called emergency medicine, which I hadn't really had much exposure to as a student and as a junior doctor. And it suited my character, it suited my interest in, I guess, problem solving in a way that I hadn't been inspired perhaps as much as I could have been in other specialties. So I've spent the last, I guess, 20 years learning emergency medicine, all the way up until about 2018, a few years ago. I was a trainee and then working at consultant level in the NHS as an ED doctor, so an A&E consultant towards the end, basically. And that was done in parallel. It took me such a long time because in parallel, I continued to work in an advisory capacity within the healthcare industry. So I did quite a lot of work in the independent healthcare space, and as a result ended up being offered a job as the group medical director of a group of hospitals. Unfortunately now defunct. It was called Aspen Healthcare, sold to Nuffield after I left. I left because I'd been offered a job in China, and I spent 2 years in China fairly recently being the vice president of medical affairs, which is a posh American term for group medical director, vice president of medical affairs for a group of 8 Chinese, American owned, but hospitals in China. We had also about 34 clinics, about 500 doctors from 34 countries, and a number of other outlets as well. I think we had about 3,000 staff in total. It was a really fantastic job, which came to an end abruptly at the beginning of the pandemic, because I had to return to my family in the UK at that point. And so since then, I've been working pretty much full time as the CEO of Careful, which is a company that I started a few years actually before I went to China. So that's a canter through a fairly wiggly career.
About Careful, how did you come to start there?
So I think that there's a couple of things. One of which is obvious, which is that as a junior doctor, one of the things that I hated about being a junior doctor was just the sheer wealth of task-based admin, pen pushing. I mean, just really ridiculous amounts of low-value task involved in doing the job, most of which was involved following up on jobs that you were required to do, and trying to find out where your patients were. So we would obviously carry with us handover sheets with lists of patients, usually produced by an Excel spreadsheet, sometimes just handwritten. And that was back in the 90s when I was a junior doctor. And as I progressed in my emergency career, I realized that this was still happening. There's so many doctors and nurses carry around little bits of paper that are used to note down jobs. I mean, it's bonkers. It's properly bonkers. Now, that may be improving in some places, but on the whole, hospitals, healthcare clinics, and pretty much all of healthcare is held together with the equivalent of sticky tape and string. And it's held together by the goodwill and the good offices of junior doctors and nurses who do their best to struggle through the day, badly supported or unsupported by the IT systems that have grown up around them. And I'll add one other activating event, which is that my mother was very nearly killed by a hospital in the UK because somebody forgot to give her a fluid balance chart at a critical point. She went into hospital with a sodium of 114, I think it was, which is pretty dangerous. And they've loaded her up with fluid without managing her fluid balance properly. And as a result, she became fluid overloaded and very nearly died. And that small task that needed to be done, which was to put a fluid balance chart at the end of her bed, must have been said by somebody, but nobody noted it, nobody remembered it. And as a result, she spent several weeks in hospital and several months recovering. I've talked about this and I've written about it as well. There's so many things to be learnt from patient safety incidents, not just such as that. Almost all patient safety incidents allow us opportunities to learn. What I'm increasingly frustrated about is that this one continuously repetitive error that happens in various different guises every day throughout healthcare is pernicious. And that error is that people forget stuff. They forget stuff because they're required to either write it down on a piece of paper, or they write it down and then they don't have it, or it gets put in the progress note on the electronic medical record, but nobody turns that into an action. Stuff is just lost and forgotten. And I'm not criticizing any of the individuals or indeed the systems or organizations that allow this to happen. I'm just saying it is a fact and it's something we ought to do something about. So anyway, my attempt at developing Careful was really as a handover solution. So a solution for the fact that people wander around hospitals with bits of paper, which is frankly nonsense. So it started off life with this quite restricted scope of trying to solve a pernicious problem which shouldn't exist, which is that people are using bits of paper and pencils and little they're using Excel spreadsheets, Word documents, sticky notes, supplemented by telephone conversations, corridor meetings, conversations over coffee, bleeps, telephone calls, emails, and WhatsApp messages. I mean, WhatsApp is ubiquitous in healthcare, maybe less so in the UK because no one used WhatsApp, right? Well, I can assure you that I've spoken to plenty of people who say they do rely on WhatsApp and they use it for patient identifiable information because actually that's the expedient thing to do, because if you can't get hold of your consultant or you can't speak to your fellow radiologist and you want them to look at an X-ray, you just send them the name through WhatsApp or whatever it might be. It's because there isn't a platform for universal connectivity to improve safety and productivity as there is in other forms of in other walks of life. So I mean, I tell you what, I'll ask a rhetorical question of our listeners, and I'll ask you, Stephen, if I may. If you reach into your pocket and bring out your supercomputer, which is either an Android or things, to which app do you turn in order to collaborate with your family, friends, and business associates?
WhatsApp.
If you live in other parts of the world, you might have said something else, but pretty much everyone in the Western world will look for WhatsApp. Yeah. Now tell me which app you turn to in order to collaborate with your doctor, nurse, hospital, other people that may be.
I don't have one.
Precisely. So if you look at the problem space around collaboration within hospitals, which is essentially what handover is about, handover sheets, making sure people don't forget stuff, people knowing where their patients are, ensuring that at the end of a shift or between teams or between locations, everybody gets the same picture about the critical information that is necessary to understand what is happening to a patient. That problem exists at the boundaries of all healthcare institutions, as well as it does within them. So if I say to you, in our view, Careful believes that there are three key things you need to know about any patient at any circumstance, and that is what is happening now, what is happening next, and critically, who is responsible. Now, in order to know some of those things, maybe you need to have a retrospective view of what happened yesterday, the day before, maybe even you want to look back at an X-ray that was taken last year, but that's pretty rare. Most of the time, you want to know what's the status of this patient. What is the plan for care? How are we going to get them to the next stage? How are we going to make them better? How are we going to stop them from returning to hospital, or how are we going to get them out of hospital, and so on. So what's happening now, what's happening next, and who is responsible? Those three things are necessary even when you're well. So as a man of a certain age, I probably need to have my HbA1c tested. Is that on a list anywhere? No. I've got to a stage in my life where the GP ought to have rung me up and said, why haven't you had your HbA1c tested? Because you should have done, according to international standards. And, I probably ought to have my lipids done as well, but I haven't. So what is happening to me as a patient is that I'm pretty much well. What is happening next is that I probably need to have some screening for maybe, I don't know, probably need to have bowel cancer or my diabetic risk checked, but not very much, right? But who is responsible? Well, there's a good question. We don't really know who's responsible. Most of the time, for patients who are well, the responsibility lies with the patients when it probably shouldn't. For patients who are acutely unwell in the ICU, for instance, then that becomes a much, much more complex set of questions. What is the state of the patient may vary from moment to moment. What's happening next? Again, maybe the result of decisions which are taken at the bedside multiple times a day. And who is responsible is often left to, I won't say chance, but I will say something close to that, is left to serendipity, maybe. We assume that the junior doctor has heard that this needs to happen, or that the nurse knows that needs to happen. It might get written down, it might be in the EMR notes and so on and so forth. But that complex and acute care is just a sort of compressed version of what happens to people when they're well, which is that we still need to know what's happening now, what's happening next, and who is responsible. So the short answer is, I developed Careful quite a long time ago, initially as a handover system. And then my team and my co-founder, Ruhi, and I have now created a much more sophisticated product, which is designed to answer those questions in other scenarios.
Is Careful being used currently in a clinic?
It is actually, and in fact, you'll be pleased to know this, given that I understand that you hail from Australia originally. We have a GP in Australia who is using this actively, and he loves it, because it's precisely those questions about what's happening to his myriad different types of patients that he can understand more readily with Careful. So maybe I should just tell you what Careful is and what it does, so that it puts that problem space into, or the problem description into some sort of context. So it is a task and chat-based real-time clinical collaboration platform. I've said that enough times that it rolls off the tongue, but it needs a little bit of explanation. So real-time means that everybody gets to see the same picture at the same time. Clinical means that it is geared and specialized in such a way that it is useful to clinicians, and to, in the future, we expect it to be useful to patients as well, directly. And collaboration means that it's task and chat based. In other words, we want to have the answer to the question of what's happening next and who is responsible encapsulated as this person is going to do this job at this point. And what we then do is we then offer the users, or the organizations that use it, the ability to dynamically and easily set up lists of patients in teams. So teams are where patients and users meet. So you can have a team which is location-based, so it's ward-based. It can be specialty-based, cardiology or physiotherapy. It can be condition-based, like diabetes, or it could be that it's all the patients we think we're going to try and get home tomorrow. Or it could be, as it is in the case of the gentleman using it, the GP using it in Australia, all of my mental health patients that I look after in a, I think they call it a boarding house, but it means a halfway house, so people who are in the community under the treatment of mental health treatment, but are stable enough to be in the community. So he looks after 20, 25 of those. He also looks after 80 elderly care patients in an aged care facility. And he also has a variety of different subgroups of patients, like, for instance, all his rheumatoid patients. He can put those patients into a team. And most importantly, with Careful, you can invite people from outside your clinic to become part of that management group for that particular team. So he can get the specialists from the local hospital to become part of his diabetic team. He can have rheumatoid specialists only see those patients in his list that are appropriate. And he can use his the system to ensure that he knows what the practice nurse has done when she sees the asthmatic patients. The GP can write down things like, make sure you get a peak flow on this patient and know that that action will not just disappear into the ether. So in the clinic setting, Careful has immense power to supplement the existing systems that are designed to run the practice. And I think I'll stop there and just take a moment to emphasize that Careful is not, it's a new category of thing. It's a real-time healthcare collaboration platform, which is a different type of thing than an EMR. An EMR is designed to run whatever institution bought it. So if you buy Epic and you put it into your massive multi-billion-dollar hospital in the center of London or Sydney, that's fantastic because that product is designed to run your hospital. It does all of the business processes that are required, and most of which are intensely complicated. And if you have a small clinic, then you'll have an electronic medical record system, which is specifically for your needs, whether it be general practice, as a physiotherapist, a dentist, whatever. Careful is designed to sit on top of that. Somebody suggested the other day that while the AMR is the cake, Careful is the icing. It's designed to make it much easier, quicker, and more effective at communicating and collaborating with colleagues. So that's a long and rambling answer, I think. I don't know.
No, it's a good.
Keep on.
So tell me, is it a cloud-based solution?
Yeah, so technically it's based on Azure, Microsoft Azure. So we have installed all of the necessary data protection elements that would ensure that it's properly safe and secure, because people do say to us, oh, patient identifiable data, it's got to be blah, blah, blah. And we have various servers around the world that ensure that we've got data residency where compliance requires that. But it's supported by Azure, and it's easy to sign up. You can just sign up and away you go. Okay. And that makes it possible for us to offer the platform very low cost and very rapid installation. So I think that's the thing that's happened, of course, in the last few years, is that people have recognized that cloud-based solutions, if they're properly configured, are so much better than what you might want to put on-prem. There is quite a lot of concern in some quarters, particularly about health data, about having it off-prem, because cloud is potentially less safe. But I think anybody who's been watching the trends, you'll see that almost all health data is now being put on Amazon Web Servers and Azure servers, because, and I shouldn't forget Google. And there are other cloud providers are available, although not many. So those three providers are providing most of the healthcare data for new applications these days. So that's
some of the recent successes, maybe some of the trials you're running.
Yeah, sure. So I mentioned the GP in Australia, but closer to home and in the UK where I work, there is we're proud of two. We have essentially acute care hospitals at the moment using the system. So the longest standing installation we have is with Maidstone and Tunbridge Wells Hospital, and we're working in the ICU department there. Their challenge was being able to manage critical patient information across two sites. So they've got doctors, consultant level doctors that work across both sites, and who needed to hand over to each other and know what was going on both sites, even though they could only be in one place at one time. So the junior doctors manage, and nurses, in fact, manage the critical patient information, what we call the handover categories. So we could see what's going on with each patient. They manage them in different sites, and so then they can, the senior doctors can see what's going on in both places. What we're proud of the fact that very rapidly they eliminated all paper from the handover process. Now, I think if you go into most ICUs, there will be somebody clutching a piece of paper. Now, I'm not saying that they don't use paper at all, because actually they have to, because the actual, they don't have an electronic ICU information system. They have the the traditional big A0 pieces of paper at the end of the bed, and that's how they manage their patients. But managing the transfer of information between individuals and between shifts is done using Careful, and that's provided a much safer and I should say more auditable position. So what I didn't mention earlier is that the Careful is very keen on understanding which person's looking after which patient, because it's often the case that you would stand by a patient and say, whose patient is this? And the poor passing doctor or nurse, and you ask them, they're like, I don't know. If you're lucky, you'll have a named nurse above your bed in a hospital. But actually, this tells you who's on duty, who's looking after the patient. We've expanded it to outreach. We've expanded it to the physios, and we're also able to use it for people to refer patients. So when a random and slightly panicky junior doctor rings up and says, I've got a patient that's not very well, can you please come and see him? I think they need to go to ICU. They put this down on Careful so that it doesn't get lost, and then they make the decision. And then if the patient then arrives in ICU later on, that record gets transferred into the ICU list, so they don't miss the information about why the patient was admitted. So it begins to give you the flow of information, not just between shifts, but across the boundaries that exist in hospitals. I mean, I think I have often said that what Careful is trying to do is to provide this opportunity for us to seamlessly and easily transfer data across boundaries within healthcare. And there are so many of them. It's not just between shifts, but it's also between teams, between locations, and most often, I was going to say catastrophically, but often it's catastrophically between community and acute care and vice versa. So as you go into hospital, if you've had the experience yourself or with a relative, you come in clutching a piece of paper explaining why the GP has sent you, or with an ambulance handover sheet, which gets subsumed by the hospital notes. And you lose track of that. Then days or weeks later, you emerge as a patient out the back of the hospital, clutching a piece of paper that tells you what your drugs are and to come back if it starts to hurt. And it's just sort of like all of that critical information that describes the patient's journey inside the hospital just doesn't get out of the hospital. Now, most GPs would probably say, well, I don't want to see the whole patient journey. And that's the point of Careful. Careful is not providing people in the outside world access to the entire patient record. It's giving them the critical information that they need to be able to answer those three important questions about what's happening now, what's happening next, and who is responsible. And that's so much deeper and more useful because it's task-based and has chat function as well, that enables people to collaborate across those boundaries. I go back to my point about where do you reach, where in your phone do you reach in order to collaborate with people? And the answer is, for most people, it's WhatsApp. And you can't do that in healthcare for potentially good reasons historically, but not for good reasons now. So that's what Careful's trying to do. What I didn't tell you is I want to tell you one more success story, which is, I think, really important, because it's really important to the state of the nation, as it were, not just in the UK, but in many parts of the world, which is and also dear to my heart because I'm an emergency doctor, is the problem of patient flow through the front door. Now, you'll easily be able to understand that Careful is great for managing tasks as patients run through the hospital and out the other side, and so is therefore ideally placed to really make an impact on discharge planning. And we're actually running a project or two on that, but we don't have any data yet, but we know it's going to be successful. The place where we can already say it's been successful is in a hospital in the west of Wales. We've been running this for 5, 6, 7 weeks, something like that, 8 weeks maybe, and they have managed to eliminate paper on the patients that are coming into the medical team as unscheduled for unscheduled care. So they come in via a variety of means. They always end up in the emergency department, and then prior to Careful, there was a folder that somebody wrote in to say where the patient was and when they'd arrived and what was wrong with them, and then they would bleep the medical registrar, who would write it down on another piece of paper, and then they'd bleep the SHO, who'd say, and then they'd be told to go and see the patient, and then they'd see them and write in the notes, and then nobody would know. And I just know this from being in an ED. At some point, there'd be no room in the inn, and the nurse in charge would be like, "What's happening to the patient in cubicle C?" And everybody, "Oh, it's a medical patient. We don't know." And so then they'd bring up everybody. So now we've managed to eliminate paper in what we call the medical take, and as a result, the the patients, there are fewer patients in the ED. Anecdotally, and I don't have enough robust data to be able to put my hand on heart to say this is exactly true, but according to the ED consultants telling the medical consultants, they think that it's gone from an average of 30 to an average of 15 on a good day. Obviously, they have bad days, and they have a lot more than 30 medical patients in their emergency department sometimes. And of course, because of the nature of patient flow, they sometimes have a lot less. But the suggestion is that the peaks and troughs are being ironed out by the fact that everybody knows what this patient's ready to go home now, and this patient's ready to come into the ward, and people can see that. Now, we're hoping that this will then extend to the rest of the hospital, and we'll be able to extend the benefits of this to the entire patient journey, because I think what's interesting about those smaller hospitals that have not been highly digitized, still rely on paper, plus maybe a hospital information system that manages bookings and billing if you're not in the UK, and not much else. The problem for that is you've got this weird hybrid of paper and electronic systems, where if something doesn't work, you don't go to the IT department and say, can you do this function with your new EMR, create a function on the EMR, or create a new module or whatever, because the answer is no, it'll take a decade to do that. And anyway, you know, by the time we've done it, the needs will have changed. There isn't enough agility in those old systems so the people rely on bits of paper. You know, they just create the systems around the IT in order to patch the holes. And the point about Careful is that it's agile enough and user configurable enough that we can do that for pretty much any hole. In fact, we were talking the other day to a company that does emergency evacuations across the world, and they're like, wow, you mean we could have a system whereby everybody saw the same medical record as the patient was evacuated from wherever it might be, sent elsewhere in some foreign country where they don't belong, all the way through a third country back to home, so that they can have definitive treatment, having, I don't know, fallen off a mountain or whatever. All those, that is a really, really difficult patient journey that we can just mop up really easily. And so it's as I think I've said before, is that healthcare has got these incredible boundaries and barriers within them, and Careful is there to try and help the flow of information across those boundaries.
Okay, fantastic. Now tell me, if people want to reach out and communicate with you, how do they do that?
So our socials are Careful Online. I think you can find us on Twitter. I think we have a Facebook page, but no one uses that. But LinkedIn is the best way. You can find me. DJ Hamblin Brown is easy to Google, and I think Careful comes close to the top. And it's also careful.online is our website. So Careful Online, and you should find us.
All right. Well, thank you very much for today. It's been a pleasure to meet you, and I look forward to talking to you again very soon when some of the results of these activities that you're engaged in are published.
Stephen, it's so nice of you to have us on the show, and thank you so much for asking those questions. I very much hope that we'll be back to tell you all about the successes.
You will.